Our need statement is a way to monitor for recurrence in patients with bladder malignancy to reduce the cost and discomfort of disease surveillance. So we're going to start with mechanical solutions to this problem.
So right now it's through the urethra. So that could be one approach, is using the same approach through the urethra.
So the broad category then will just be different approaches. So either transurethral, which is here, or suprapubic, transvaginal.
Transrectal. We'll kind of put those in the same,
Transrectal.
because those are alternate. Is that okay?
Do you
Sure.
want to off this one?
So basically any way to access the bladder.
Yeah.
I guess we're thinking of every possible way you can do that.
You said trans what?
So trans,
Transrectal, transvaginal, and suprapubic. All right. So maybe if we go through the urethra, if we're trying to be more comfortable and more cost efficient than cystoscopy, one approach could be just to develop a better cystoscope or a cheaper cystoscope.
Yeah.
So,
Change size, cystoscope.
or maybe some type of coating for the cystoscope.
or to actually line the urethra with something that reduces the pain or discomfort associated with transit of devices.
So pre-treated.
Yeah.
Yeah. Yeah, even if it's just a numbing agent or something, that would make it at least more comfortable.
Sure.
There's some overlap once we start talking about this in terms of the imaging too. So how we want to image. So for example, right now cystoscopes are using some kind of optical camera, but if we wanted to talk about the imaging, but maybe we could talk about the imaging modality separately.
Okay.
So what other ways can we still screen for bladder cancer through the urethra? So we're changing the cystoscope size, we're changing the material it's made out of, we're pre-treating possibly to reduce the discomfort. But what other ways? I mean, if we can think about ways that we could surveil not every 3 months, but surveil once a year.
Okay, so change surveillance guideline, right?
So
Yeah.
then this may actually tie in with a chemical,
Component or something like that, yeah.
Right.
Yeah, that's true.
so something to disrupt the cells, to agitate the cells,
Right,
to make
so-
them more easily captured.
In terms of the specifications, it's helpful to keep them in mind because you know pretty much the high level goal of what you're trying to reach. But you also don't want to be constrained by what's there, because if you come up with a great idea that may be more effective in one way that you can overcome or kind of revisit the need specifications, then that's actually a pretty valuable tool. So it's good to keep it in mind so it keeps you focused, but at the same time, don't be constrained by it.
I think our biggest things we all go back to were cost and discomfort.
Mhm.
So when we talked about approaching through urethra or changing the cystoscope properties, all these ideas are based on how to make it more comfortable. So flexibility or size or things like that. And then we talk about alternative approaches. We're thinking about things that are less painful for the patient.
Yeah, yeah. In this case, the need is really about comfort, but right now, patients really don't like the cystoscopy. The other criteria that we've kind of put on there as well are to help the adoption, because the patient isn't necessarily the decision maker. So how can we get adoption that actually benefits the patient, but still the solution is in use? So.
It's probably hard to work with a constraint of cost or price at this point. So I think it's maybe the next stage we can maybe focus in on that a little bit more, but at this point it's a constraint. It doesn't really give you much direction.